Advertiser disclosure: pregnancy and childbirth are costly, and medical bills aren't simply explained. With price and insurance coverage differences spanning tens of thousands of dollars, deciphering the expenses will take some work, but you can do it with our help. Read this guide to understand your coverage. Know what costs to expect when. Set your mind at ease about the anticipated expenses. Having a baby is expensive, sometimes alarmingly so. Navigating through the costs of 9 months of pregnancy and then the cost of raising a child can seem overwhelming, but knowing what to expect can help. Major differences in cost and coverage: any guide to medical bills and your share of the cost should come with several disclaimers. Prices vary considerably from city to city, and even local hospital to local hospital. Researchers at the University of California, San Francisco, found in 2014 that, in the Golden State alone, the cost of an uncomplicated vaginal birth varied widely, from $3,296 to $37,227, depending on the hospital. Cesarean sections ranged from $8,312 to almost $71,000. If you have health insurance, coverage differences are similarly dramatic. Also, because the ACA doesn't define precisely what must be covered under these umbrellas, insurance companies have interpreted and applied the stipulation differently. Price and out-of-pocket cost estimates are handy but are only estimates. The only way to know for certain what you'll pay is to contact your medical providers and health insurance company. The more work you're willing to do on the front end, the less likely you'll get surprise bills in the mail. Get a handle on your insurance. If you're unsure how your health insurance works, now's the time to research your benefits. You could take an entire course in understanding your policy, and still likely have questions. Consider this a cram session. Your top 2 study areas include: contact your health insurance company, with policy number in hand, and ask these key questions, making sure to write down whom you talk to and the date. Are prenatal care, labor and delivery covered benefits under my policy? Do I need a referral from my primary care doctor to see an OB/GYN or other specialists? Will I need pre-authorization for any prenatal care? What prenatal tests are covered? Ultrasounds, amniocentesis, genetic testing, etc. What common prenatal, labor and delivery needs are not covered by my policy? Which hospitals in my area are in my insurance policy's network? What do I need to do to ensure that my newborn is covered from the moment of delivery? How long of a hospital stay is covered after delivery? Does my policy cover a private room or suite, or will I have to share a room? If you're interested in non-traditional deliveries, like a home birth with a midwife, for instance, ask about coverage for these. Throughout your pregnancy and into your baby's well-child visits, err on the side of caution. If at any time you are unsure about your coverage and want to be doubly safe, call your insurance company to get confirmation in advance. Watch out: depending on your medical provider's billing practices and your due date, you could be caught having to pay 2 deductibles if your prenatal care happens in 1 calendar year and your baby is delivered in the next. Some providers package their charges to insurance companies in what's called global billing, which can include all prenatal and delivery charges. Ask your OB/GYN whether he or she plans to use global billing so you'll know where you stand ahead of time. Uninsured? Seek help. If you don't have health insurance, you're looking at tens of thousands of dollars in care over the next 9 months. Despite requiring health insurance companies to offer woman and maternity care, the Affordable Care Act has a notable shortcoming in that it doesn't consider pregnancy a qualifying event. This means you have to wait until your child is born to sign up for a new plan under the ACA. But ACA insurance plans aren't your only option. If you meet income requirements, you could be eligible for Medicaid. If you're forced to pay cash for your maternity care, be a smart healthcare consumer. Comparison and price shop for prenatal visits, tests and your labor and delivery. Explain to your doctor and all medical providers that you are a cash-paying customer. They often offer discounts for uninsured patients. Negotiate lower balances and payment plans on your medical bills. Ask the hospital about any charity care programs that may be available. Consider a maternity package, increasingly offered by hospitals as a way for new parents to get all of their maternity and childbirth expenses covered under one price. Cost breakdowns: during a routine pregnancy, you'll have several standard appointments and tests. Any special concerns about your or your baby's health could mean more doctor visits and interventions, all potentially coming at an additional cost. A note on ultrasounds: who wouldn't want to see their little bundle of joy grow from week to week? Unfortunately, that can get pretty expensive. Ultrasounds cost hundreds of dollars each. If you're uncertain about coverage, call your insurer when you know your doctor has one planned. Expected expenses first trimester. If you have an uncomplicated pregnancy,